Hey everybody, we're out here today at Rosedale Acupuncture and Wellness, where they have an innovative approach to treating stubborn and chronic health conditions. We're talking today with Dr. Lucas Brown more about what goes on here at the clinic and how they can help. Dr. Brown, good morning.
Good morning, Rosie.
Good to see you.
Thank you.
I don't often start with this question, but I'm really excited about it. I hear that you love your job.
Absolutely. I think it's fair to say I feel like I have the best job in the world. You know, the patients that come see us, they are dealing with a lot of complex chronic conditions, and they're the type of patients that have just basically been told that there's no hope for them, right? So, you know, if they're lucky, the doctors are like, oh, it's just a part of getting old. You're just getting older. And then maybe they're given another pill, you know, to the 15 pills they're already taking. But that's not really something that's acceptable for us. You know, our goal, not to sound cheesy, but I think, you know, my goal is to help people become the person they remember themselves being.
Yeah, you actually say you feel like you work in a time machine.
Exactly, yeah. So I'm kind of a sci-fi nerd. So yeah, I definitely feel like, you know, this little time machine here, we got patients feeling 10, 15 years younger than what they actually are. Patients that are in their 20s and 30s, you know, they come in, they say like, I feel like an old man. You know, they can't get out of a chair without helping themselves up with an arm. You know, they have trouble.
Make a lot of grunting.
They make a lot of grunting. They're stiff. They have trouble, they have a lot of brain fog, trouble remembering names, places, just stiff all the time. They just say like they feel old, right? So our goal for those patients is really just to feel their age again, right? They're young. They're supposed to be out active, not worried about anything, really just out enjoying life. But the majority of our patients are really already in their 50s, 60s, 70s, and beyond. And so what they tell us is they feel like 100 years older, right? So for them, they're like, oh, I feel 150. So to get someone that's just to feel 50 again makes all the difference in the world. You know, that's able to walk their dog, able to dance, able to go on vacation, to walk upstairs, able to drive by themselves. So I think, you know, as far as quality of life goes, that's a big difference.
Yeah, really restorative. And speaking of, one of the top things that you treat here is peripheral neuropathy. My brother actually has this, and I know that you and I talked off camera. It's something that really can be degenerative. Can we talk a little bit about what it is?
So absolutely. So peripheral neuropathy affects an estimated 20 million people in the U.S., and it is something that generally just gets worse over time. A lot of the patients use similar adjectives to describe it. It's a little different in every case, but a lot of them describe, you know, pins and needles, numbness, burning sensations. Tends to be worse at night for most people. You know, they can't have the sheets over their feet at night. So they're not sleeping well, they're tired all the time. And they don't trust themselves driving because they can't feel the brake or the gas pedal. A lot of our patients will wear shoes that are an extra size too big, or they're stuck wearing Crocs, which, you know, no judgment. We're not fashion police here. I've actually seen like a lot of really cool looking Crocs walk through these doors.
Sure.
So,
but you don't want people to be relegated to just
exactly.
Crocs.
It's very limiting. Like, you're not going to go ballroom dancing in Crocs, right? So if that's their goal, is to get back dancing, that's great. But again, it does get worse over time. So really, the real concern for us is when it gets to the point where your balance is affected. So yeah, if I can help people, you know, get their mobility back, you know, get the sensation, the feeling back in their legs, get more balance, I'd say that's a pretty great job.
Yeah. And something that you said to me is that, you know, because it's such a large continuum, you treat every single person who comes through these doors differently, because in some cases it might be holding the neuropathy and keeping it from getting worse, and in some cases it might be improvement, right?
Absolutely. I'd say for the most of us, we want to get improvement, but then, you know, once we get that improvement, then it is really a matter of like staying there. I often tell my patients that my neuropathy patients, they are patients for life, but what it looks like is different for each person. So our goal is to get them out, say like a treatment every 6 weeks, to kind of maintain that lifestyle and where they're at. I've been doing this long enough that I have a good idea, if I can help you, what it's going to look like. So I recommend, you know, any patient that's been told there's no hope, just to live with it, to come in with a consultation. I can meet with them, we can discuss, come up with a plan if I think it can help you, and kind of take it from there.
And speaking of, we'll hear from actually some of your patients and about how happy they are with their results.
Some days I could hardly walk, and I kept falling. I have a sunken living room, so I kept falling. And when I was diagnosed with my lung cancer 2.5 years ago, the side effects were just almost too much. So I've been coming here about a little over 6 months. I haven't fallen as much. I was able to almost run down my driveway the other day when my dog was pulling me. I was surprised myself I could walk that fast.
Peripheral arterial disease was my diagnosis, and I was referred to a cardiovascular specialist who ran tests on me and came out after reviewing them and said, well, the good news is you won't be seeing me again. You won't be seeing my ugly face again. What's the bad news? I can't do anything else for you. I made an appointment right away, and after meeting with Dr. Brown, I felt he was trustworthy and competent, and the good news was he could do some work with me that would improve my neuropathy. He didn't promise sun, moon, and stars, but he promised that I could be better. It was a rapid recovery. It was amazing to me.
It's really wonderful to hear. And speaking of all of the wonderful services that y'all do, you actually do more than just acupuncture here. In fact, it's in the name.
That's right. So, our name is Rosedale Acupuncture and Wellness, but we do so much more than that. I think that's part of the reason why we get the results that we get, right? We really like to combine the ancient art of acupuncture with more cutting-edge modern technologies. And so, if this were a play, sometimes acupuncture is not even the main character. It can kind of play a supporting role. And one of our other modalities is really what we use to treat the condition. But every patient's different. And I also want to be very clear, I have nothing against Western medicine. If you've been told there's nothing you can do and there's no hope, that's one thing, but I think that's just what they know. And Western medicine is really great at acute care, right? So nothing's going to save your life more than Western medicine. It's the best in the world when it comes to saving lives. Remember that old song we learned in grade school, like the toe bone's connected to the foot bone, connects to the ankle bone, and I can't sing, so I'm not going to try and sing that song for you. But I think somewhere along the way in medical school, we kind of forgot that, right? And we start to look at a pinky, as an earlobe as an earlobe, as a nose as a nose. But here at Rosedale Acupuncture, we really don't separate that. We don't treat the pinky on itself or the earlobe by itself or the nose by itself. We really treat the whole person. And each person is an individual and different, so treatment's going to look a little bit different for each person.
Interesting and really cool, a very different approach and really great results coming from it. Dr. Brown, we so appreciate your time this morning. Thank you.
Well, thank you. Yeah, appreciate it.
Set up a complimentary consultation today by calling 512-623-1996 or by going to rosedaleacuwell.com. This segment is sponsored by Rosedale Acupuncture and Wellness.